Hey, what's up, guys? It's Iggy from the Investing Iguana, and today I'm going to talk about how to get the most out of your Singapore government health benefits. If you're a Singaporean citizen or permanent resident, you probably know that we have a pretty good healthcare system here, but do you know how to make the best use of it? In this video, I'm going to share with you some tips and tricks on how to save money, stay healthy, and enjoy your golden years with the help of the government. So, without further ado, let's get started. Tip number 1. Understand the different types of health financing schemes and subsidies. The first thing you need to know is that there are different types of health financing schemes and subsidies that you can tap on, depending on your needs and situation. These include A. MediShield Life. This is a basic health insurance plan that covers large hospital bills and selected costly outpatient treatments, such as dialysis and chemotherapy. It is compulsory for all Singaporeans and permanent residents, and you pay premiums using your CPF MediSave account. You can also use MediSave to pay for the deductibles, co-insurance, and any costs above the claim limit of MediShield Life. B. CareShield Life. This is a long-term care insurance plan that provides monthly payouts if you become severely disabled and need personal or nursing care. It is compulsory for all Singaporeans born in 1980 or later, and optional for those born earlier. You pay premiums using your CPF MediSave account until age 67 or when you make a successful claim, whichever is earlier. You can also use MediSave to pay for the premiums of CareShield Life supplements, which are private plans that offer higher payouts or additional benefits. CHAS, this stands for Community Health Assist Scheme, and it provides subsidies for medical and dental care at participating general practitioner, GP, and dental clinics. It is available for all Singaporeans, regardless of income level, but the amount of subsidy depends on your household monthly income per person or annual value of your home. You can apply for a CHAS card online or at any community center. D. Healthier SG. This is a new initiative that aims to help Singaporeans take steps towards better health and quality of life. It will provide you with a choice of your preferred family clinic that will guide you to stay healthy, a customized health plan and support to achieve your health goals, and access to community programs to help you stay active and healthy. It will be rolled out progressively from 2023 onwards. Tip number 2. Choose the right healthcare provider and ward class. The second thing you need to know is that you can choose the right healthcare provider and ward class that suit your needs and budget. In general, there are 3 types of healthcare providers in Singapore. A. Public healthcare providers. These include public hospitals, polyclinics, and specialist outpatient clinics. They offer subsidized rates for Singaporeans and permanent residents who choose B2 or C class wards in public hospitals. They also accept MediShield Life, CareShield Life, CHAS, and MediSave payments. B. Private healthcare providers. These include private hospitals, clinics, and laboratories. They charge higher fees than public healthcare providers, but they may offer more choices, convenience, and comfort. They also accept MediShield Life, CareShield Life supplements, and MediSave payments, but the coverage may not be sufficient to cover the full cost. C. Integrated healthcare providers. These are public-private partnerships that offer a range of services from primary to tertiary care. They charge fees that are between public and private healthcare providers, but they may offer more integrated and holistic care. They also accept MediShield Life, CareShield Life supplements, CHAS, and MediSave payments. Before you decide which healthcare provider and ward class to go for, you should think about some important factors that may affect your health outcomes and experience. These factors are: 1. The type and severity of your condition. Depending on what kind of illness or injury you have and how serious it is, you may need different levels of care and expertise. For example, if you have a minor infection or injury, you may be able to get treated at a polyclinic or a GP clinic. But if you have a major surgery or a life-threatening condition, you may need to go to a public or private hospital. 2. The availability and quality of the service. You should also check how easy it is to get an appointment and how long you have to wait for the service. You should also look at the qualifications and reputation of the healthcare provider and the facilities and equipment they have. For example, if you need a specialized test or treatment, you may want to go to a provider that has the latest technology and the best track record. 3. The waiting time and accessibility of the service. You should also consider how convenient it is to get to the service and how long you have to stay there. You should factor in the travel time, the parking fees, the public transport options, and the opening hours of the service. You should also think about how long you have to wait for admission, consultation, treatment, and discharge. For example, if you need urgent care or have a busy schedule, you may prefer a service that is nearby and has shorter waiting times. 4. The cost and affordability of the service. You should also compare the prices of different healthcare providers and ward classes and see how much you have to pay out of your own pocket. You should take into account the subsidies, insurance coverage, MediSave usage, and other payment options that are available for you. You should also look at the hidden costs, such as medication, follow-up visits, and additional tests or treatments. For example, if you have a tight budget or a low income, you may want to choose a subsidized service or a lower ward class. 5. Your personal preference and comfort level. Finally, you should also think about what matters most to you and what makes you feel comfortable and satisfied. You should consider your personal values, beliefs, preferences, and expectations for the service. You should also look at the environment, atmosphere, privacy, and amenities of the service. For example, if you value choice, convenience, and comfort, you may want to choose a private service or a higher ward class. Tip number 3. Make use of preventive health services and programs. The third thing you need to know is that you can make use of preventive health services and programs that can help you detect health problems early, manage chronic conditions better, and adopt healthier lifestyles. These include A. Screen for Life. This is a national screening program that offers subsidized screening tests for common chronic diseases such as diabetes, high blood pressure, high cholesterol, colorectal cancer, and cervical cancer. It is available for all Singaporeans aged 40 years old or older who have not been diagnosed with these conditions. You can book an appointment online or at any participating GP clinic. B. Health Promotion Board, HPB, programs. These are programs that promote healthy living through education, campaigns, incentives, and activities. Some examples are Eat, Drink, Shop Healthy. This is a program that rewards you with points when you buy healthier food and drinks at participating outlets. You can redeem your points for vouchers or lucky draw chances. National Steps Challenge. This is a program that encourages you to be more physically active by tracking your steps and rewarding you with points and prizes. You can join the challenge online or via the Healthy 365 app. Quit Smoking Program. This is a program that helps you quit smoking by providing counseling, medication, and support. You can sign up online or call the Quit line at 1-800-438-2000. Healthier SG programs. These are programs that will be offered under the Healthier SG initiative, such as Healthier SG Family Clinics. These are clinics that will provide you with personalized and comprehensive primary care, including chronic disease management, health coaching, and referrals to specialist care. Healthier SG Community Programs. These are programs that will help you stay active and healthy in your neighborhood, such as exercise classes, cooking workshops, and health talks. Tip number 4. Plan ahead for your future healthcare needs. The fourth thing you need to know is that you can plan ahead for your future healthcare needs by saving up, investing wisely, and making your wishes known. Some ways to do this are: A. Save up for your healthcare expenses. You can use your CPF MediSave account to save up for your healthcare expenses, such as MediShield Life premiums, hospital bills, and long-term care costs. You can also top up your MediSave account or your loved one's MediSave accounts to enjoy tax relief and higher interest rates. B. Invest in your health. You can use your CPF investment scheme, CPFIS, to invest part of your CPF savings in various financial products, such as stocks, bonds, unit trusts, and insurance. You can also use your supplementary retirement scheme, SRS, to invest in similar products and enjoy tax benefits. However, you should be aware of the risks and fees involved in investing and seek professional advice if needed. C. Make your wishes known. You can use the Advanced Care Planning, ACP, process to discuss and document your preferences for future medical care with your loved ones and healthcare providers. You can also use the Advanced Medical Directive, AMD, form to indicate that you do not want any extraordinary life-sustaining treatment if you become terminally ill and unconscious. You can also use the Lasting Power of Attorney, LPA, form to appoint someone to make decisions on your behalf if you lose mental capacity. And that's it for today's video. I hope you learned something new and useful about how to get the most out of your Singapore government health benefits. If you did, please give us a like to show your appreciation. It helps us know what kind of content you find useful and valuable. And if you haven't already, please subscribe. Here at the Investing Iguana, we're passionate about helping you achieve your financial goals with ease and peace of mind. And we have a lot more to share with you. Stay tuned for our upcoming videos, where we'll explore other important financial topics like how to use CPF and SRS to boost your retirement savings, how to invest wisely and safely in the stock market, and how to make your money grow faster and smarter. We're so grateful to have you as part of our Investing Iguana family. Your support enables us to keep creating free content like this. Remember, every like, share, and subscribe makes a difference. Thanks for watching today. Keep investing, keep learning, and we'll see you in the next video. Take care.